Great. Well, hello, everyone. Thank you so much for joining us today. It's a pleasure to be here with you all. I'm Ashley Harris, and I'm the Director of Operations and Sales here at ClinicTracker. I'd first like to share with you that the Carequality connector has become what it has thanks to your input. Over the last few months, we have met with some of our clinics to understand the current landscape you face day in and day out, trying to access patient records for intake and treatment of your clients. Through these conversations, we identified solutions to better support you and overcome these challenges. I'm fortunately joined here today with Matt Smith from No2, a steadfast partner of ours here at ClinicTracker. Matt has a background in inpatient psychiatric care and is a dedicated champion of improving care coordination for all, and specifically passionate about ensuring that underserved populations are afforded the same advancements as others. We are extremely grateful for our partnership with No2 and proud of the technical advancements we are able to share with you today. We're also joined by Betsy Bayardi, who is one of our integral team members here at ClinicTracker. She leads many partnerships to ensure that we are consistently offering you all of the best resources possible. Just a few housekeeping items before I turn it over to Matt. Once Matt has finished sharing his presentation with you all, we'll open it up for questions. Please ask questions using the questions chat box in the GoToWebinar panel. Should be on the right-hand side of your screen. You can also raise your hand if you feel it will be easier for you to talk through your question. And now it's my pleasure to hand it off to Matt.
Excellent. Well, thank you, Ashley. And to all who are in attendance, I really do appreciate your time. I think Ashley did a great job of setting up the partnership that is extremely significant between No2 and ClinicTracker. And as Ashley mentioned, No2's mission has always been to serve the underserved population. In this case, it's both patients and it's parts of the market that weren't affected by meaningful use. We set out originally to create connectivity and communication channels to enable the effective care of patients. As it relates to behavioral health or mental health care, it is something that is extremely personal to me. I've worked in healthcare IT for the last 15 years between the hospital space, the care coordination space, and now in what some would like to refer to as interoperability. But a lot of time has been spent in inpatient psychiatric facilities and seeing things from depression to dementia. And in my opinion, you as providers face one of the most unique challenges in the market from a care standpoint, because you're not only dealing with physical conditions, you're also dealing with someone's mental well-being. So access to information is absolutely critical to both your planning for an admission, the coordination of care when an admission happens, and the treatment planning associated with the optimal outcome for that patient. And that is what our partnership is really about. So we're going to talk today a lot about the care quality connection, but we're also going to talk about some issues that are really pervasive throughout the space. So with that, I will allow the control of the slides to go to the next screen. Really, when I look at any type of patient care and care coordination, I look at it in three ways: receiving information, sending information, and in the event that you're unable to find the information that you need, access to data sources to help you prepare, plan, and validate information to treat that patient. And, this is a typical use case. Patient visits the ER, they have a mental condition. A lot of times the ER has no capacity to keep them there. There aren't facilities in the area that can take that patient. But there are also some significant challenges with transitioning that patient into another setting and providing the appropriate documentation to help you plan for that patient's arrival. So with No2 and the embedded partnership that we have with ClinicTracker, we basically have a tunnel for you both to send information, to receive information. And what we're going to focus most on today is finding information. For those of you who aren't aware of Carequality, I'm going to give you a brief explanation of it. But first, I want to talk about the Carequality connector that ClinicTracker has invested significant time and money into because they understand the importance of it to you and to your patients in their treatment and treatment planning. If we go to the Care Connector slide, that'd be great. So the Carequality connector, is essentially a tool that allows you unfettered access to all clinical data associated with a patient that's available within the Carequality network. For those of you who aren't aware of what Carequality is, I'd like to talk to it in numbers first, and then in its practicality second. There are over 150 million transactions and documents that are shared through the network each year. I want to be very clear about what Carequality is. Carequality is a framework, not a repository. And the idea is it's open access to data without the need for a response. So I'm not sending out a request for information. I'm not making a phone call. I'm not relying on a fax coming in. I'm not relying on anyone else. I'm given access to a framework of over 4,300 hospitals and more than 50,000 providers that continues to grow every day, that I can query that patient and pull all available information on that patient in. So you're getting patients from the ED. You're getting patients from social services. You may be getting patients from the local police department. You may have patients that self-report, and all of those patients have very unique needs. And your ability to gather access and information about their clinical history is extremely important, because without it, you have to rely on self-reported information. So while you'll still collect self-reported information, the information that you can gather via the Carequality connector within ClinicTracker allows you a validation point as you develop that treatment plan and optimize outcomes. Next slide. So just to summarize, the key points here are it's faster onboarding. You're getting more real information, real time, to prepare for that patient, to admit that patient, and to make informed care related to that patient's specific needs. Things like current medications, allergy, prior conditions, and other clinical notes from previous or historical encounters are extremely important in this process. And the uniqueness and the expansiveness of the Carequality network provides you with almost more information than you may need. But it provides you that information that you might not otherwise have without access to it. And then you're relying on either manual requests for information or the self-reported data the patient provides. So the goal here is back to my original comment. You're receiving information, or maybe not. You could be receiving it via fax. You could be receiving it via direct secure message. You could be receiving it, in an ambulance as the patient is being transported to you. But one way or the other, the ClinicTracker Carequality connector allows you access to go out there and actively search for more information about that patient in a secure way. And it also opens up the ClinicTracker system to both protect the patient's information that's documented within the EHR, but also expose the relevant points of it to other providers of care that that patient may see down the road. And I think that's extremely important. You're getting a lot as you prepare for that treatment of the patient, but also that information, where appropriate, is shared and accessible across the healthcare continuum, so that other providers that patient may encounter have access to it. So we're going to go quickly to a demonstration And I'm going to hand it over to Ashley and Betsy for this component. And then I'd be happy to answer questions about the importance of Carequality and the framework that's been established to seamlessly exchange information.
Thank you so much, Matt. This is Betsy. Now that Matt's gone through some of the use case, I wanted to make sure that you all had the opportunity to see, especially since you're all familiar with the system, how the workflow actually is set up. So hopefully you guys can all see this. First thing that's going to happen is that you'll either search by a specific organization, which we're doing here, or by a hospital referral region to determine where you want your information to come from. And then you'll select the individual that you're looking for information on. And then what you'll get back is a list. We're in a test environment, so we have one record, but you may have multiple locations that are able to provide records on your patient. And then we can pull that directly. And as Matt said, this is not a request back and forth or a fax. This is quick access directly to the information. Once you've identified information that you're interested in, you can also download it directly to your patient file within ClinicTracker. And all of this is happening within, like 2 minutes. And then for those of you that are administrators, in terms of identifying who has accessed which files, we've also included an audit log so that you can tell exactly what dialogue has been going back and forth between your staff and the portal. And with that, I will turn it back to Ash. Thank you.
Well, thank you so much. I think now is a great time to open up the conversation for questions. So Betsy, I don't know if you have any questions in the chat yet, but please feel free to add them in on the right-hand side in the chat box or raise your hand and we will unmute you so we can talk through your question.
I don't see questions yet. I'm just going back through the attendees, however, just to see if anyone has their hand up. I don't see any questions. Matt, I know that you have some experience with common questions and things that do generally come up for folks. If you have some of those that you might want to share with us.
Yes, in preparation for this, we talked to several ClinicTracker customers to understand their workflows and to understand where they go to gather information. Where they have to send information, whether that's upstream, downstream, or to an HIE. So I guess my question for the group would be, when you need information about a patient, are you going out to an HIE? Does your state, like in New York, have a claims database that you can go out and search for records on? Are you having to go outside of your system and outside of your clinical processes to find information relevant to that patient's care?
Oh, we do have a question, and hopefully I can find it. This question is from Brina Milligan. When discharged from inpatient to us, the hospital faxes us the discharge document. Do you want, let me see if I can unmute you if you would like to expand on that at all. Let's see. Oh, I think you may have to do that yourself. Oh, wait. Oh, I don't know that I'm able to unmute.
Hopefully I get the gist of the question, so let me adjust that. I'm assuming
Oh.
that if you can unmute, that'd be great.
Yeah, it looks like she's not in a position to be able to do that. So we'll have to do it through the chat.
Yeah, so when a patient is discharged from the hospital, yes, there is a discharge summary. There is also a document created called a CCDA. The CCDA is a structured document that was part of meaningful use that can be transmitted in multiple ways. It could be transmitted via fax. It could be transmitted via a direct secure messaging address, etc., and then ingested into your system. You could also actively, via Carequality, go out there and look at that record real time while the patient's still in the facility before the physician signed off on those final discharge orders. So it's allowing you real-time access to that patient information as well as historical information related to that patient and other settings of care. Does that answer your question, Brina?
Let's see. I don't see a response to that, but I do see a question from Brooke regarding client consent and requirements.
Yes, that's going to be a state-specific topic to address. There are states that have regulations that require consent before you can do a search to identify patient information. But in most cases, under the terminology or under the definition of treatment in HIPAA, as a treatment provider, you're really allowed access in most states to all relevant information required to proactively prepare for a patient and actively treat a patient. There are certain states that it's what they would consider an opt-in or opt-out, where a patient could say, no, I don't want my records shared. And if they choose to not share their records, then the records collected in ClinicTracker would not be available via the Carequality database. But other records from other systems or other encounters would be.
We also had a clarification asking to confirm that a hospital not using ClinicTracker is actually still able to share that document.
That is correct. With the integration that ClinicTracker has with No2, No2 is really a utility. We don't have to be seen, but when we talk about receiving information, sending information, and finding information, there's a channel to receive that information via fax or direct secure message directly into ClinicTracker from an upstream system, as well as to send that information out of ClinicTracker to another system, and then via the Carequality connection to surface that data for query purposes to other care providers.
That's great.
Okay, I think that takes care of a lot of the questions that we have. I'll turn it over to Ashley so that she can talk about if you have further questions, how you can get those to us.
Sure. Matt, I did just want to ask, on behalf of our clinics, do you have any feedback that you would be able to share with us, perhaps from other clinics that have, used Carequality, to make their lives easier? I know right now folks are really, there's some challenges with staffing and all of that. So anything we can do to make their lives easier is, part of our mission. So if you could just share some of that, I think that'd be really helpful.
Yeah, the staffing shortage, the burden placed on existing staff and staffing turnover is a problem that's ubiquitous across the healthcare continuum. And most of that is a direct reflection of the administrative overhead it takes to get the information needed to properly treat a patient. what Carequality does is basically provide what I would consider a highway of information, and direct access without the need for a response. Cutting down on those administrative tasks of sending out a request for information, making a phone call, asking for additional information from a receiving facility or a primary care provider. So from a staff retention standpoint, it's allowing them to be the clinicians that they were trained to be, not someone that operates a fax machine or stands behind a phone and waits for a return phone call in hopes of getting some relevant information to prepare for that patient encounter. And in many settings of care, this problem is exactly the same. It's the first visit is almost wasted because I don't have enough information about that patient to make clinical decisions. So I'm having to try to gather that on the first encounter, validate it, and then come up with a treatment plan. With access to information real time, that eliminates a lot of that, number one, administrative burden, but also a wasted patient visit. Especially when we talk about the mental health community, the needs are pressing. Physical conditions are one thing. There's protocols, and it's very easy to step through how to treat a heart attack or a stroke, etc. When you combine the mental health aspects of that, it becomes extremely more challenging because you have to consider the physical aspects, the physical health of the patient, while also assessing their mental well-being. And wasting a visit, ultimately could lead to the waste of a life. So we see that the access to real-time information via Carequality and the work that ClinicTracker has done is really is vital to the proper and efficient care of patients.
Well, thank you. Thank you so much for your time, and thank you all that have joined us today. It's been a pleasure as always. If you'd like additional information such as pricing, or if you're considering activating the service, please contact us, myself, Mark, or Chris, your sales team members. You can also reach out you can also reach out through the support portal, and we would certainly be happy to help you. So thank you all so much. I hope you guys have a great week.
Thank
Thanks,
you.
Matt.
As we sign off, I just want to add,
Yes.
any questions that came in, we will send out a response to you as after the call. And thank you all very much for your participation.
Thank you all for your time.
Thank you.
Bye-bye.